I'm Shabna Fathwima K, Vice Principal and ICA BC IDS Staff Coordinator, and here I would like to clarify the doubts of the breast cancer, the soft muscles that needs attention to take care and live healthy. Why is October the month of breast cancer? The early goal of Breast Cancer Awareness Month was to educate women about breast cancer and early detection tests so that they could take charge of their breast health. One of their key goals that they wanted to achieve was to promote mammograms as an important tool to be used in the fight against breast cancer. Why does breast cancer have its own month? In 1985, National Breast Cancer Awareness Month, NBCAM was created as a collaborative effort between the American Academy of Family Physicians, AstraZeneca Healthcare Foundation, Cancer Care Inc., and a variety of other sponsors to raise awareness and gain funding for yourself through the research for a cure. What are the symptoms of breast cancer? New lump in the breast or underarm, that is armpit, thickening or swelling of parts of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk including blood. How do you beat breast cancer? If diagnosed, follow these tips to help fight the disease. Establish a treatment team. Breast cancer treatment crosses multiple disciplines and usually includes a surgeon, medical oncologist, and radiation oncologist. Ask for help. Eat healthy and exercise. Vitamins are drugs. 2. Stay away from illness. How can I boost my immune system to fight cancer? These 5 science backed tips can help keep your immune system as strong as possible during cancer treatment. Sleep well. Aim for 7 hours of sleep a night. Eat smart when you're on immunotherapy. Eat a range of healthy foods. Get moving. Exercise is key for a healthy immune system. Manage your stress. Keep away from illness. I invite the attention of all my dear teenagers of ICA English Higher Secondary School, parents, teachers, and the women of our society and community. Yes, it's time for each of you to take care of your breast, as this is COVID-19 crisis that we are undergoing, and we do not take the initiative to keep ourselves fit by doing regular exercises and eating healthy, especially during this breast cancer awareness month. I invite the attention of our girls, teenagers, parents, teachers, and the women of our society and community. It's not too late. Being COVID crisis 19, we are facing an idle period, a time without proper exercises, and just ignore our own health. So ensure to do regular exercises on time. Eat healthy, stay safe, avoid breast cancers, being conscious of yourself by loving yourself. SHAHEEN.
Good morning, everybody. Thank you very much for giving me this platform to share some information with you. It's my honor to share some time with you. Today I would like to talk to you about cancers, and in particularly breast cancer. So cancer, as you all know, is an uncontrolled growth of cells which tend to proliferate into an uncontrolled way. It can spread into the other sides of the body as well. There are 100 types of cancer, out of which breast cancer is one of the most important one. So why is it important? It's important because it's one of the most common cancers seen in women. Out of the 14% of cancers in Indian women is breast cancer. every 4 minutes, one Indian woman is diagnosed with cancer. So, the importance of this cancer is if you are diagnosing it earlier, there is greater chance of successful treatment and survival. So, what are the warning signs of breast cancer? Different people will have different symptoms or different warning signs. Some people won't be having any symptoms at all. But the most important warning sign which are seen in the patients are the new lump in the breast or under armpit, flaky skin, redness or dimpling in and around the nipple area, change in the size of the breast, nipple discharge other than the breast milk, which can include bloody discharge or pus or whatever it is. You have to keep in mind that most of the symptoms can happen with other conditions as well, but it's important that if you have any of these symptoms, you have to get it checked out to make sure that it's not cancer. So who are the people who are at high risk of developing this cancer? This condition the risk increases with age. So the condition is most common in women who are over the age of 50 and who have been through menopause. 8 out of 10 cases are seen in the women who are over the age of 50. If you have a close relative like mother or sister who have breast or ovarian cancer, then you have a higher risk of developing the breast cancer. Or if you had a breast cancer before, then also there is a chance of relapse or having breast cancer again. So taking hormone replacement therapy or oral contraceptive pills for a long time, being obese or getting pregnancy after the age of 30 and not breastfeeding at all, and being obese, these are all the other factors or high risk factors which can cause risk, which can increase the risk of breast cancer. So what can you do to reduce the risk of getting the breast cancer? You have to make sure you know what's normal for you. So you have to periodically examine your breast at least once in a month and make sure there is no changes happening in your organ. If you notice any mild changes, please don't ignore that changes and get it checked out to make sure you are safe. See a doctor and make sure you are safe. Also, studies have shown that breastfeeding reduces the risk of breast cancer. So make sure if you get a chance when you are having the kids, make sure you breastfeed your kids. Some countries have this breast cancer screening program like UK and Qatar, where they call the ladies who are over the age of 50 to undergo a mammogram, which is a special type of X-ray, to make sure they are not developing any breast cancer. So I would strongly advise the ladies who are over the age of 50 or the ladies who are at high risk to undergo mammogram at least once in 3 years to make sure they are safe. If you are a high risk person of developing the breast cancer, I would advise to avoid hormone replacement therapy or oral contraceptive pills, because it can increase the risk of developing the breast cancer. Last but not least, I would advise you all to keep a healthy diet, exercise regularly, and maintain a healthy weight so that you won't become obese, because obesity, as you all know, is a high risk for not only for breast cancer but also for other diseases as well. So stay safe. Thank you very much for listening to me and giving me this opportunity to share some wisdom with you. Thank you. Also, I would like to thank the staff, the teachers and the students of ICA school for giving me this opportunity to share some time with you and to share some knowledge with you. Thank you.
മുലയൂട്ടലിന്റെ പ്രാധാന്യത്തെക്കുറിച്ച് നമ്മുടെ പുതുതലമുറയ്ക്ക് നല്ല സന്ദേശങ്ങൾ നൽകാം. ഒരു കുഞ്ഞ് ജനിച്ചതു മുതൽ അമ്മയും കുഞ്ഞുമായുള്ള ആത്മബന്ധം അനുഭവിച്ചറിഞ്ഞവർക്ക് അതിന്റെ മാധുര്യം നന്നായി അറിയാം. കുഞ്ഞ് ജനിച്ച് അരമണിക്കൂറിന് ശേഷം ഭക്ഷണമായി നൽകേണ്ടത് മുലപ്പാല് തന്നെയാണ് എന്ന് എല്ലാ ശിശുരോഗ വിദഗ്ധരും പറഞ്ഞിട്ടുള്ളതാണ്. കുഞ്ഞിൻ്റെ ശരീരത്തിലെ ഇളം അവയവങ്ങൾക്ക് വളർച്ചയ്ക്ക് ആവശ്യമായിട്ടുള്ള എല്ലാ ഘടകങ്ങളും മുലപ്പാലിൽ അടങ്ങിയിട്ടുണ്ട്. കൂടാതെ പാലൂട്ടുന്ന സമയത്ത് അമ്മയുടെ സന്തോഷത്തോടു കൂടിയുള്ള നോട്ടവും ചിരിയും തലോടലും എല്ലാം കുഞ്ഞിൻ്റെ സ്വഭാവ രൂപവൽക്കരണത്തിന് കൂടി കാരണമാണ്. നമ്മുടെ അമ്മമാർ നമുക്ക് നൽകിയ ഉപദേശങ്ങൾ നമുക്ക് നമ്മുടെ മക്കളായ എല്ലാ പുതുതലമുറ സഹോദരിമാർക്കും ഗുണപാഠമായി നൽകാം. 2 വയസ്സുവരെ തീർച്ചയായും കുഞ്ഞിന് മുലപ്പാൽ നൽകണം. 6 മാസം മുതൽ മറ്റു ഭക്ഷണങ്ങൾ നൽകിയാലും വെള്ളം അധികം കൊടുക്കാതെ മുലപ്പാൽ തന്നെയാണ് കൂടുതലായി നൽകേണ്ടത്. ഈ അമൃത്, മുലപ്പാൽ എന്ന ഈ അമൃത് വില കൊടുത്താൽ കിട്ടാത്ത ഒരു വസ്തുവാണ്. സാധാരണ കുട്ടികൾക്കുണ്ടാവുന്ന എല്ലാ രോഗങ്ങൾക്കും പ്രതിരോധനത്തിനുള്ള ഘടകങ്ങൾ മുലപ്പാലിലുണ്ട്.
സ്തനകോശങ്ങളുടെ അമിത വളർച്ച മൂലം ഉണ്ടാകുന്ന രോഗമാണ് സ്തനാർബുദം. സ്ത്രീകളിലും പുരുഷന്മാരിലും സ്തനാർബുദം ഉണ്ടാകാം. ലോകത്ത് ഏറ്റവും കൂടുതൽ ഉണ്ടാകുന്ന 2ാമത്തെ അർബുദമാണ് സ്തനാർബുദം. അർബുദം മൂലമുള്ള മരണങ്ങളിൽ 5ാം സ്ഥാനമാണ് സ്തനാർബുദത്തിനുള്ളത്. പ്രായം വർദ്ധിക്കുന്തോറും സ്തനാർബുദത്തിനുള്ള സാധ്യത ഏറി വരുന്നു. സ്തനാർബുദ സാധ്യതയുള്ളവർ 50 വയസ്സിന് മുകളിൽ പ്രായമുള്ള സ്ത്രീകൾ, പാരമ്പര്യമായി കുടുംബത്തിൽ അർബുദം ഉണ്ടായിട്ടുള്ളവർ, 10 വയസ്സിന് മുന്നേ ആർത്തവം ഉണ്ടായിട്ടുള്ളവർ, 55 വയസ്സിന് ശേഷം ആർത്തവ വിരാമം ഉണ്ടായിട്ടുള്ളവർ, ആദ്യത്തെ ഗർഭധാരണം 30 വയസ്സിന് ശേഷം നടന്നവർ, തീരെ ഗർഭം ധരിക്കാത്തവർ, ആർത്തവ വിരാമത്തിന് ശേഷം അമിതവണ്ണം ഉള്ളവർ, തീരെ മുലയൂട്ടാത്തവർ. 20 വയസ്സിന് ശേഷമുള്ള എല്ലാ സ്ത്രീകളും മാസത്തിൽ ഒരിക്കൽ സ്വയം പരിശോധന നടത്തേണ്ടതാണ്. ആർത്തവം കഴിഞ്ഞ് ഒരാഴ്ചയ്ക്ക് ശേഷമാണ് പരിശോധന നടത്തേണ്ടത്. തുടക്കത്തിലെ കണ്ടുപിടിച്ചാൽ ഒരു പരിധിവരെ ചികിത്സിച്ച് സുഖപ്പെടുത്താവുന്ന രോഗമാണ് സ്തനാർബുദം.